Hi there, I'm Tash.
And I'm Damo.
And we are so excited to bring you this week's episode of The Bari Chronicles.
Today we are talking with Dr. Sally Ng, who is a specialist plastic surgeon.
How amazing is that? Very, very exciting.
Yes.
Thank you so much for being here, Dr. Sally.
So we're here with Dr. Sally Ng. I hope I've got that right. Excellent.
Thank you so much for joining us, Dr. Sally.
Yeah, it's really exciting.
It is.
Yeah. So could you tell us a little bit about yourself and your journey to becoming a plastic surgeon?
Yeah, so this is my 8th year since I obtained my fellowship, as a fully qualified plastic reconstructive surgeon. So I've always had an interest in plastic surgery since I was quite early on in medical school. And I think it's quite a long journey to really get to this point. I mean, most of us would have had to finish medical school, and then we have to do quite a number of years of postgraduate training. Then we have to apply into the plastic surgery program and go for a couple of years of training before we can become fully qualified plastic surgeon. So yeah, it's been quite a long journey actually, but I'm glad that we all make it in there. And most of us would have done some additional fellowship training. I've certainly traveled to a few places and observed from some of the people from other parts of the world in terms of how we do this surgery. So this is where I am at the moment.
That's excellent.
That's amazing. You've worked so hard to get there, and I just really admire that.
Yeah, me too.
So, as you know, we run a support group for people that have had weight loss surgery, and plastics is something that comes up so often.
Yeah.
And I think one of the big questions that we get asked is, when can I start looking at having plastic surgery? What would you say to someone that was just sort of going down that path and looking at getting some plastics done?
Well, I think it's only I think the body contouring surgery, especially in the setting of massive weight loss, is a very rewarding sort of aspect of my job. I think certainly look after patients who really had to put in the hard work, through dieting, through maybe some medical surgical intervention, and get to that point. And I think there was obviously a component of improving the aesthetics of the body, but also a lot of the time it's really just helping them from a functional perspective as well, so that they can have a more normal life after some of these weight loss journey. And there's no an exact sort of time point of when you can intervene, but at the very minimum we really need them to get to a stable weight for at least 6 months. And often when we determine that stable weight, I think maybe specifically referring to patients who had bariatric surgery intervention, for example, like that will be very much guided by their bariatric surgeon. So I do work very closely with some of my colleagues who look after the bariatric side of things, and they will often tell me, okay, look, I really think a patient has reached a stable phase and they don't think they're unlikely to drop any further, and we want to make sure that weight is at least stable for 6 months, and then we can start having that conversation and have the discussion. Obviously there are other patients who may not have necessarily involved a bariatric surgery, and they might just be through dieting or through other using Ozempic or Syndexa or the other of the medications. So those patients, we might be looking at the overall percentage of the weight loss. So we really wanted to, at that point, probably look at the changes in the BMI. So as you know, I mean, the BMI, will sequentially sort of drop over, the various points of the intervention. And I mean, often it might be involved their GP or their endocrinologist who might be prescribing those medications. So again, it's very important for me to have a conversation with the specialist or the GP involved with that care to see if they have reached a stable weight. But I think, certainly, there are some sort of, I guess, general concept that, okay, you need to be at a BMI of certain, figures before you'll be considered suitable. But I think for me, it's a bit more about, the absolute changes in the BMI rather than the actual number itself. Certainly have to, I think you may not like realistically ever get to say BMI 30, but like 35 is say maybe their absolute lowest that they will be able to get to. And I think that might be a time where you can say, okay, It's a matter of, having a discussion about the expectations, and even if you can drop their weight, by having some surgery and functionally improve their posture, and they might be able to exercise a bit more and, even sort of get the weight down a bit further. So I think, for me, there's no absolute figures, but it's about, the changes, over time. And I think if they reach to a stable BMI, then that's probably a good time to at least have a conversation and then discuss whether they're appropriate to proceed to the next step.
That's amazing, because when I first started,
it does my heart good to hear that.
Having my chest done, I'd gone from about a 68 BMI down to a 30, and I was told, oh no, you need to get to a 25 before I'm going to touch you. And I was like, oh my gosh, I've just lost 110 kilos and all this. And then the marker, it just felt like it was moved so far away that it was unachievable. So I really like that you look at sort of a person as a whole person, not just
as the
a number.
Yeah. Well, I think, look, obviously there will be, I guess, some, like, plastic surgery is quite individualized sort of thing. And I think, we have different conversation with different colleagues. And I think, everyone had our own, I guess, set of theories and belief to some extent. But certainly if you look at the trend, particularly in, say, America, like, a lot of them are sort of, happy to operate in patients in the BMI of 30s. And I think it is just a matter of having that conversation with the patient to know, okay, look, your BMI is still a bit high, but realistically, you might have already had a sleeve and a bypass, and we just can't get you down to any more, reasonable weight. And I think you kind of had to put everything on a plate and see, okay, look, yes, your wound complication might be slightly higher than, someone who'd be BMI of 25. But if that can help you to get you in a better sort of functional state, and I think it is worth having that conversation. And, this is something that I think, personally, at least, like, as a surgeon and a patient, you need to have that conversation to see if this is the right thing for you. Yeah.
That's excellent. That's very good.
Very refreshing, isn't it?
Very refreshing.
Something that I think we touched on before we started the recording. I think it's important for people that are having it to understand that it may not leave us looking like the magazine model that we're, that we've sort of watched for years, how do we manage our expectations? I think.
Yeah. Yeah, that is a very important topic. And I think, look, sometimes, for me anyway, I do like quite often spend, quite a few hours just talking to patients just to really sort of set their realistic expectations. And, what we're really trying to achieve is just removing any redundant skin fold, obviously as a result of the weight loss. And sometimes, the skin fold can happen in many different parts of the body as well. So, you have to, having the first thing is really just asking the patient, okay, what is the area that really bothers you the most? And, like we then sort of I get them to like generally fill out a questionnaire to, prioritize their different area. So they're basically different, questions looking at, okay, are you having functional issues? Are you just sort of disappointed about the appearance? And then, so, I think by helping them to rank all the different areas and what they're mostly concerned about, that kind of helped to put them into a bit of perspective about, what they really want to achieve. Because, you can have someone who come in telling me that, okay, well, this is the area that I don't like. And, I can look at them and say, well, these are the area that I think I can improve. But if you don't match up with that expectation, this is when I think, we're going to have an unhappy patient. So I think, listening is quite important to begin with. But also, the main thing is understanding that, okay, look, especially if your BMI was, say, a bit high, like, you may not get that full deflation. So sometimes you're really just removing that skin fold that you've got, but you may still have some, underlying, fatty tissue that we couldn't fully remove. And I think it's quite important for people to understand that liposuction really isn't like a good option for, weight loss patient in particular, because your skin just don't really retract the same way. So I think I always say to patient, look, if you're worried about scars, then, this is not something for you, because unfortunately the surgery will leave scars. And I think, for them to understand that, okay, look, this is really trying to remove the skin fold rather than, kind of making the skin a bit flatter, like that is the result of the weight loss. But, like the whole body contouring surgery is about lifting the skin, removing excess skin. And I think, having that sort of, concept, discussed early on, and, letting them know that the scars will be there is quite important. And then
I
after
agree.
spend quite a lot of time, I think, just looking at it in the mirror in terms of telling them exactly where the scar sort of sits. And sometimes we'll, take some photos and sort of draw out where it is as well. And I think, let them go home and have a think about whether this is a scar that they're happy to accept. Like, obviously, some of the scars are quite well hidden, tummies and, the back, breast are usually, hidden enough. But things like, the thigh and, the arms in particular can be quite obvious as well. So I think they're the things that it's quite important to set the expectation early that, okay, this is not going to be a scarless sort of surgery. People will see it, but, this is to help you to wear your, short sleeves a bit better, or the longer sleeves better even, or, removing that sort of sagging. And, so I think those things are probably, important consideration and discussion early in the consultation. But I think I've been quite fortunate, that most of the patients, after spending a couple of hours, really discussing it, they do actually, I guess, understand the process, and, haven't had a very unhappy patient coming in. This is where, you really need to just sort of match up that, expectation early on, I think.
Yeah, I agree. I think that it's a very, very important conversation to have. I probably went into my first plastics with I definitely did go in with unrealistic expectations. I had imagined my head on a body that was not ever going to look like mine was able to look, and it was difficult for me to come to accept the reality of my skin. But I'm completely fine with it now. And, my surgeon was great. But it was definitely a me thing. It was a me problem, certainly not, not anything else. And it was tough because I think as bariatric people, we spend so long in bigger bodies that we just really want them to look different. And with all of that loose and redundant skin, it my body morphed into another thing that I just didn't really recognize. So it's good that you've got such an awareness of that. It really is.
I think it's very difficult because obviously, like at the end of the day, like you guys have done a lot of hard work getting to that way, and you really want to be rewarded. And so, I think that's actually, very, very hard sometimes. And I think, look, you can sort of talk about a lot of these things, but without actually, I think, visualizing that sort of, outcome is also hard to sometimes make that expectations as well. Like, I think sometimes having some photos kind of helps. Like, I do occasionally show patients some photos just to maybe assist with that. Yeah. I guess, process. And, but I also, a bit cautious about, certainly some photos, giving the false expectation as well. But, like, I think this is where, the couple of the consultation before the final surgery kind of helps, because then, I think the main thing is, I never want patient to rush into the surgery. Like, you get to this point, I just want you to really take the time, think about it. And, like when you feel like you're really ready, then I think this is, a good time. And I think, whoever you're seeing, you need to feel comfortable with the surgeon as well. I think that's really quite important. Like, I think, you both have to feel comfortable with each other, because, often you might be doing more procedure than just a one procedure. So I do encourage, if, a patient want to see a couple of different surgeons until they find a person that they sort of gel with, I think that's actually very reasonable, because you are trusting them with a big surgery. Yeah.
Yeah, that's right.
I think that's great, because I think for a lot of our members, it almost feels like they're betraying the first surgeon if they go to anyone else. And, it's like, no, that's not how the surgeons are feeling. They,
but I think, look, it's obviously, like, I think, from our perspective, look, like, I think if I see someone, and I hope that they feel comfortable with me, and then they will, like, follow through the surgery. But I think it's a very mutual thing, right? Like, I think if you come in to see someone for some reason you're just not comfortable, then I think it's better to pull a pin and say, okay, go and see someone else and see how you feel. Like, because, at the end of the day, like, I think there are many reasons that, that you like certain person, right? You have to feel you trust certain person. And I think it's quite important that, you do, you do your research, and I mean, look, you can go online and read a lot of reviews, but it's about how you feel about that person. So I mean, I certainly, like encourage people to, if you need to, just see one or two people. You don't need to see like 10 surgeons, I think, but like just get an opinion, make sure you're comfortable with the decision, because sometimes I think we might give you a slightly different opinion as well, depending on what we think or what our experiences is. So, like I think,
that's right.
getting a second opinion is not a bad thing. Don't feel like you couldn't do that. Yeah.
Yeah. So when it comes to preparing for surgery, is there things that that bariatric patients, or I suppose just patients in general, should bear in mind in terms of how their blood tests should be prior? Should they be prioritizing taking their vitamins? What are the things that you're looking for and checking to make sure that they're healthy enough and well enough to be able to have the surgery?
So look, from my point of view, and again, I guess this is probably mainly my opinion on some of these things, but we'll obviously take a pretty extensive medical history when the patient comes to see me. So number one is really making sure that their metabolic status is good. So often the bariatric surgeon will still check their blood tests, especially if they had gastric surgery or bypasses. So your iron, B12, folate, all that kind of micronutrient needs to be quite optimal. We also look at some of the other common medical conditions that may be associated with people who had a history of weight loss, like, and some of them might have diabetes or blood pressure problems or heart issues. So I think they need to be quite well addressed, and also there may be situations where there's a history with obstructive sleep apnea as well. Like again, you want to make sure that they've had that attended to, or whether they're still using CPAP, that type of thing. I think the other main thing for me is obviously anything to do with wound healing. So like there's a history of diabetes that also need to be quite well controlled. So we often look at the HbA1c level. For me, like I definitely do not sort of like to offer surgery with patients who still smoke, because I think this is a very elective surgery, and it's very hard because I think smoking quite often is a bit of a stress-induced kind of issues, and there's a lot of behavioral sort of issues attached to that as well. But trying to get people to come off this cigarette is not always the easiest. But I think for me, this is the biggest factor that I can reverse to make sure that there's no complications, or at least minimize a complication to the absolute lowest. So I always had to tell my patient that if they smoke, then I'll get them to look at ways to work with their GP to quit before they consider surgery. And again, like this is an elective surgery, so I think it's really important that we do things as best as we can to try and minimize the risk. And I think most of my colleagues around town will also sort of had a pretty similar theory around that. And I think, the final thing really is just any other, potential surgical history in the past associated with anesthetic, like if they had any, issues with, clottings or, like any major anesthetic reaction, like we need to sort of look into that before we, talk about the next steps of surgery. Yeah.
That's excellent.
Wow.
Yeah.
That's great. I love it. That was something that has come up, that there are times where people need, like Tash had multiple tummy tucks. Even though they're at their goal weight, it just seems like their skin just keeps melting.
Keeps sagging.
Keeps sagging. Is there a reason for that, or is it just genetics?
In terms of like the weight hasn't achieved like a stable weight, or you mean like your weight can still?
Like the weight's stable, but they have the tummy tuck, and then within a few weeks, it sort of seems like it's stretched back almost as much as before. Do you see that very often?
Look, I think. Again, I guess I'm just giving like a fairly general response, but the reality is that, when in body sort of contouring surgery, like, unfortunately the skin quality is quite different to say, someone who, just, I guess, had more like a tummy tuck post, say, post-pregnancy or something. So quite often, like when, certainly when I was doing the surgery, like I do need to put quite a lot of suspension sutures to try and, anchor it to some deeper sort of structure to I guess, as much as possible, try to hold the tissue, if that makes sense. Like, I think, unfortunately, because, I have been through that, the stretching from the weight loss. So the skin just don't contract, the way it is, which is why things like liposuction will never really sort of work alone, because, the skin just don't behave the same. And I think, look, certainly, I suppose, like there are situations where probably in the tummy, like you can sort of see that, like when you sort of, do the initial tummy tuck and you did give a bit of a lift stay on the mons, but then, after a while, like that mons sort of sags again. And that's often because, you're trying to really address that sort of more upper component of the tummy, and you haven't really quite done enough, to the mons. And so often people will come back, say to have a bit more of a lift, in that mons area. So that's probably like a reasonably common scenario. And the other thing I think is, if you actually have that upper kind of like an upper tummy roll, and you're really more just having like a lower abdominal plasty, then you might notice some sagging in the upper roll, but that's really more from the back. So I think this is just like a very generic, it's just a general sort of description, but you can
absolutely.
an area that seems a little bit more exaggerated. But I think that was probably because like it is actually a separate area to begin with, like, and maybe we just haven't quite, I guess, analyzed that overall. Remember when we talked about in the beginning, like you really got to sort of sit down and say which area is the sagging skin, and say to expect that like if we just do a tummy tuck and be able to address that kind of flank sort of excess skin, then that's probably not really going to work, and you'll always have to have a separate procedure for that. So I think that's probably what really happens. But like obviously, I think in terms of whether there's more sort of skin developed after an initial surgery. So unless because I have patients who will ask me and say, "Oh, what if I lost more weight?" So if I have someone who operate at BMI 35 and then they manage to lose more weight, like I think really unless you lose another good 5 or 10 BMI, you're probably not really going to see a major changes in the result. You shouldn't really expect that. But yeah, it's always very tricky because the skin quality is just not the same. And it depends on what your initial weight loss is. Like if you lost, 50 BMI, as opposed to 20 BMI, that skin quality will also be quite different. So I think, again, like quite individual, but, hopefully that kind of answers the questions. Yeah.
No, that does. That really does. Because I think particularly in our group, when we have people that lose such differing amounts of weight and they see so many different photos of people that may have had quite high starting BMI, and then it's quite easy to become afraid. Well, maybe I'll need 3 or 4 surgeries to have my skin looking. But I think what you said is perfect, and it explains it. And that's why BMI is actually important as an indicator. There is a lot of discussion around BMI within the bariatric community and whether it's relevant anymore. And I can see and understand why it would be in this type of situation with plastics, purely from the skin quality perspective.
Yeah, I think, it's interesting about the BMI concept because, like you said, there are some sort of theory to believe that, well, actually you can't always just look at the BMI and, assess a lot of, because like, I think, you can really have someone who drop so much, as opposed to so little. But I think it is sort of relevant in a sense that, as in the sort of the Medicare guidelines, like for example, you actually need to lose 5 BMI, and that was still the definition. So I guess it is relevant, to a certain extent. And I think, just having that number, I suppose, give you a bit of an idea of what the changes from your, your goal weight is. So I suppose it's just, probably more as a trend, which is why, like, to me, it's actually more important to look at the changes rather than the absolute figure. But I think, the figure itself more, like, again, like historically, when we look at a lot of the research study out there, when we look at wound complications and all that, they also use BMI as an indicator to measure that. So I think there's many reasons why people still talk about BMI and still look at that, but really at the end of the day, I think you really have to focus on who's sitting in front of you and sort of go from there.
So it really still is patient centered and what's best for them. It's just different ways of looking at what's going to be best.
Yeah, that's exactly right.
Now, something that always have a little bit of a chuckle about when the question comes up because, well, I know I actually did try. So, are there any creams that can magically make our excess skin disappear?
Well, unfortunately, not really. I wish I could. I wish there is such product available. But look, I think people talk about stretch mark and all that as well. And I think well, one of the things that I tell patients is that, well, the surgery won't get rid of your stretch mark, that's for sure. Like, I think that's quite important to understand that, because people think, oh, well, by tightening the skin, will that actually get rid of it? Well, it may temporarily improve it, but it won't really dissipate it, because the stretch mark is really to do with, the changes in the collagen, on our skin. So yeah. I think that's quite important to understand. And I mean, look, we're still learning about, the structural level of how the skin changes. I think, with the changes in the weight. So, I think maybe one day, I mean, people do talk about, some of the non-invasive things with like, skin tightening, type kind of treatment, but really in the setting of, massive weight loss, like it is quite a different skin that we're talking about. So I would encourage patients to look down that pathway. And, I think so, if someone show you a really good photo online, you got to sort of be a bit skeptical about it. Because, I think unfortunately, the skin is just not the same. Yeah.
Yeah, I totally agree. My skin's very crepey. And even though I would love to be able to rub something on it and it'd be fine, I know that will not happen.
Sadly. Well, maybe one day we'll be smart enough to be able to design something, but not in the current climate.
Not currently.
Yeah. No turmeric for you.
No magic potions.
So silicone is good after the surgery. Like, I definitely recommend patient using silicone compression garments and things. They're all, so post surgery you can do things to at least help with your scar. So I think, like, I always spend the time talking to patient afterwards about scar management. I think, certainly that will help to make sure that your scar doesn't stretch out, because some patients can get that fairly what we call hypertrophic scar as well. But I think, in terms of just improving the skin itself without any other intervention, that's sort of not quite there yet at the moment.
So how long do you recommend wearing compression garments for? Like, I know it's probably very individualized as well, but just as a general ballpark type of a thing after a tummy tuck, for example.
Yeah. Well, generally speaking, about 3 months or so is a pretty sort of, good figures. And there's a reason being that, really your wound doesn't reach enough what we call tensile strength up until around about 3 months or so. So you're really doing that, number one, to support the wound. And number two, really just to encourage any, post-operative fluid to, I guess, kind of encourage the drainage of those fluid. So it is tricky because, obviously in Australia where there are like certain time of the year, you may not really feel like you want to wear a compression garment all the time. So, I do find that, probably the winter season is the popular season, for people who want to consider this type of surgery.
That's when I did it.
Good
That's when, yeah. That was when I did it, and I lived in my garments I lived in them for longer than 3 months. I wore them for about 6 months. Just because it made me feel better. It just made it all feel like it was sitting nicely. So
I had surgical tape on over Christmas, and it was horrible.
Oh, that would have been horrible.
Yeah, it can be quite hard and sweaty. But I mean, look, the tummy in particular, because often, because of the weight loss, there will be some separation of the rectus muscle as well. So, your six-pack muscle. So, I mean, I will often repair that muscle as well. So people find that with the compression, and you don't always have to wear that full binder, but at least, like you can wear some kind of shapewear or some form of support so that, you're actually helping the posture as well, because like you might be used to a certain sort of poor posture before, and now you have this garment that actually help you to learn to, actually I got to stand a bit straighter. And so that sort of thing also really helps. So it's not just, simple scarfing or fluid thing, but also, improving that posture is actually quite important. Yeah.
That's good.
Wow. So for the guys, man boobs, gynecomastia, whatever we want to call it, it's affecting a lot of men. And I guess we see it a lot more these days. Guys talk about it a little bit more, especially in the men's chats and stuff. What can be done for us guys that are sick of our boobs.
Yeah. So I think, look, again, like, I mean, if you can sort of look at gynecomastia more in an isolation setting or in the setting of a, weight loss. But, again, like if we're talking about in the weight loss setting, which obviously what we're focused on today, like a lot of the time is to do with the skin deflation. So I think breast is quite straightforward. If you think about, and this is kind of like male, female breast, really, when you analyze a breast, you're looking at, whether you want to adjust the volume, whether you want to adjust the skin. And I mean, anything, in the weight loss setting, it's often to do with the skin deflation. So unfortunately, the way to address this is not to, again, use liposuction, but to really address the skin excess. I think in guys, it's a little bit more tricky because, in ladies, where you might do a mastopexy or something, you do have some folds to hide the scar. So for example, you'll hide the scar underneath the breast and, you've got a scar around the nipple and coming down often, like what we call the inverted T scar. In guys, like, sometimes they might want to wear, go topless, in the beach and, but you will see those scars a bit more visible. But I think, in the setting of weight loss, you really couldn't avoid those scars, unfortunately. So, one of the first things that I will talk to patients about, especially in the male sort of setting is that, well, that scar will be quite visible. But, some of them might say, well, I just wanted to get the contour right and I'm going to wear a T-shirt and they're happy and that's fine. But, certainly I have patients who come in and tell me they don't want scars. They just want to address that. And I say, well, unfortunately, I won't be able to, help you with that. So I think just understanding the difference between the male female sort of setting is quite important. And then often it will just involve redraping, the skin and then, reposition the nipple sort of position as well. But I think, looks, guys get great results, after, gynecomastia surgery. And I think, like you said, probably maybe they're a bit more shy to talk about these things. But certainly I'm seeing more and more males sort of seeking that type of surgery as well. And so I think certainly it's on the rise. I think maybe because there's more awareness of it and they know that there's something that can be done about it. As long as you understand that, there'll be a scar involved. And I think certainly, can consider that if it's indicated. Yeah.
Yeah.
And you make, because this is something that I've been asked by numerous guys, and I know Damo has as well, is can the nipples be made smaller? And yes they can, can't they?
Yeah, they can. And often, when we do, again, like same in female male breast, like, because of the way it's been enlarged, over time, like, that areola area will be quite stretched. Like we don't do anything to the nipple per se, unless you specifically want to reduce the height of the nipple, but certainly we'll actually reduce the areola area. So for example, in female breast, traditionally that will be down to, like 40 millimeters or, 42, 45, like kind of a bit of a dependent on, the discussion with the patient. And then, for male, it will be down to around about sort of usually is, aesthetically good looking, areola will be around about, like an oval shape. So, like we will sort of, make them a bit smaller just so that it's, what is aesthetically pleasing, at least on definition anyway. Yeah.
Yeah. Yeah.
That's so good.
Yeah,
I love it.
It is. It is good to know that.
It gives me a bit of hope.
Yeah. Well, you've lived with gynecomastia for a long time, haven't you?
Yeah, since I was like 12.
Yeah.
It started. And I was always told, if you lose weight, it'll go away. And, it just
I think there's different elements of it as well. Like, if I see someone, this is just generally talking about gynecomastia, then, I often will try to work out whether, how much of that is actually, glandular tissue, like actually breast tissue, how much of that is actually, fatty tissue. And then you try to work out a proportion because sometimes, you can actually see, I often sort of involve one of my endocrinologists because there are specific hormonal causes that can actually drive the growth of the gynecomastia. And for me, it's quite important to make that differentiation because sometimes we might just put patients on tamoxifen initially just to see if they get good result. But obviously this is not quite in the setting of massive weight loss. If it's like tend to be just massive weight loss and, had a lot of loose skin, then that's a totally separate sort of issue. But whereas like if it is more like a general gynecomastia, then it's important to make that differentiation because, sometimes we may actually try that medical pathway before we consider surgery as well. So,
that's
definitely.
That's good for people to know too.
Yeah. Yeah, because if you can do it without a surgical intervention, then that's even better.
Yeah, then all the better.
Yeah,
all the better.
Yeah.
When it Another question that that comes up quite a bit is to do with, I suppose it would be a healing thing, but nerve pain and things after weight loss and after skin removal.
Mm.
How common is it for people to experience nerve pain, particularly I suppose after arms?
Mm.
I know I had nerve pain for quite a while,
Mm.
and is there things that people can do to help manage that?
Mm.
That's a question that.
Yeah, unfortunately, with any of the skin related surgery, because there's a lot of sensory nerve, like in all parts. So, one of the key things that I do emphasize to my patient is that you'll definitely feel numb in that area. Now, obviously, there's a difference between just feeling numb as opposed to having actual nerve pain, and this is a bit that can be a little bit unpredictable because essentially, anywhere. So, for example, in a standard tummy tuck, like quite often, from that kind of central area down to that, obviously it's like a triangle shape almost. That area do feel very numb, and that can take anywhere, up until like 12 to 24 months to really fully recover. Now, I think some people do unfortunately get actual pain as opposed to just numbness, and that could be because there may be some nerve ending that kind of, because when you sort of cut through the nerve, obviously the nerve ending can, leave open. And sometimes if they kind of, get stuck in the scars, or they might get stuck in the stitches, and that's where you can get some unexpected nerve pain. And I have to say, it can be quite difficult to predict who will get that. But I think the main thing is, I generally sort of ask patients, look, if I suspect that, there's a bit of a risk involved, and I might get them to take some vitamin C, once a day for about a good sort of 6 weeks at the very minimum. Like, we do sort of, I mean, there's some soft science to say that, that kind of helps to, modulate that kind of nerve recovery. If there's any very early signs of, some kind of nerve sounding pain, like a bit more than a standard post-operative pain, then I might put them on some medications such as like Lyrica or any of the other like gabapentin types of medication that might help them to just, I guess, dampen that nerve down. And also I think a lot of the touching and the massaging in the wound kind of helps as well. So there's a lot of sensory, I guess, re-education in that area that can help to dampen down that pain. I think the arm is particularly sensitive as well in that area, because there are a couple of quite sort of superficial nerves that run very close to the skin. But again, like I think we try to tend to do a few different things surgically to minimize that. So for example, we most of us will actually, use a little bit of liposuction to assist the process, but, we'll still excise the skin afterwards. And we think that, by doing that, it reduces the risk of actually cutting into the nerve. So there are sort of some surgical technique that I think people try to introduce to minimize some of these, significant pain that can happen. But, a lot of the post-operative thing, like, as I said, the vitamin C, the medication, the constant touching and the massaging and all that will probably help to dampen that down. And I think the main thing is just having that early recognition, so that, if there was some, significant concern, then that could be addressed early on. Then that will generally help.
Yeah.
That's excellent.
Yeah, that's great.
Yeah.
And for our members that do suffer from lipedema and that sort of stuff, is that something that like a plastic surgeon can help with, or is that another sort of specialty?
Yeah, so I think this is quite I think unfortunately in Australia we're quite behind, in that kind of lipedema kind of space, unfortunately. Like I think, number one, there's not probably like a really dedicated, I mean, lipedema is more like a bit of a diagnosis of exclusion sometimes, because, you might have someone who come in with that quite classic sort of appearance of bilateral lower limb, sort of, I guess, that kind of heaviness in the lower limb that, sparing the ankle. And also, sometimes you think, well, is that still because, I got more weight to lose, or is this actually lymphedema, or is that actually lymphedema? Like they're all quite sort of different sort of, approaches. But I think these days, like, I think certainly, there are a couple of clinics, across Australia that started to, I guess, introduce some of the investigation. Like, we'll be looking at, the main thing really is just ruling out things like lymphedema, which, we'll often kind of do some tests to see whether the lymphatic flow is impaired. We'll do some MRI to see what the fat distribution versus fluid distribution. And then often, we'll get them to see a physiotherapist to try and, see if there's any means that they can do to try and, reduce some of that, maybe through compression, for example, to see if that actually alters the the clinical cause, and if like all those things kind of been excluded and failed, and lymphedema is kind of like the diagnosis of exclusion. And then often you'll start off with some sort of very conservative management. Like, I mean, there are some targeted programs that look at, I guess, modulating that pain, because often patients present with pain. Like, that's what, they generally talk about.
Yeah.
But a lot of those focuses on that kind of sensory, modulation. And if that sort of doesn't really work, then, I mean, sometimes you can go down a surgical pathway of doing some liposuction, for patients. But at the moment, there's no specific Medicare item number that will cover it. So unfortunately, that is still considered as a cosmetic sort of procedure, which is quite unfortunate, because, really, I think it is more medically indicated sort of, reason rather than a cosmetic procedure. But that's something that I think, we need a bit more lobbying, maybe, like in the country, to sort of, help some of the patient, getting the appropriate support through. But at this stage, this is kind of the general workup and the pathway. And there is there is some support group online, I believe. And I mean, you guys will sort of smaller support group within your forum as well, that really try to, I guess, look at, all those conservative pathway. And I think the main thing is most patients will get some improvement with their pain, but certainly, from ultimately, reducing that kind of heaviness, in the legs and all that, like, you may have to sort of really go down that surgical pathway. But it's quite a complex, issues. And certainly I think,
absolutely.
on, in our community is still quite under-recognized, unfortunately. Yeah.
Well, it is what it is. Hopefully in years to come.
Yeah.
Yeah. So what is your favorite? Do you have a favorite procedure to perform?
Oh, look, I think it's difficult to name, like a favorite procedure, but I think, look, well, I think, generally speaking, like, a lot of the patients who come and see me, like, put it this way, like, the first thing that they always want to do is a tummy. Like, I think most people, always wanted to improve on the tummy. I think tummy, breasts, arms, they're often quite satisfying sort of procedure, because you can really see the difference, like, just improve that kind of heaviness in the front, and, really improve that posture, improving all that, rashes that often, you get in between the folds. So, I mean, for me, like, every patient who, come in after those procedures are just so happy and quite life-changing. And I think for me, that's quite rewarding, actually. I think, other areas, obviously, like the thighs and the back, they're often, like good procedure as well. But, like, I think, like, most of my patients, like, probably the tummy and the breasts are probably my favorite operation. Yeah.
Yeah, I mean, it definitely changed. It completely changed my life. So I understand that it would be something that would be very rewarding for a surgeon to do as well.
Yeah.
Removing all that skin.
Patient, I've often had a couple of people who, like, just being able to be more mobile, being a lot more active, and then, sending photos, and, how they can just fit into their, the favorite dress that they, really want to fit into, or clothes or whatever. I think that's quite, it's very happy for us to see the impact that we can make, to the patients. Yeah.
And what happens to all the skin, like, that's cut away?
What does happen?
I asked my surgeon if I could get it and make a handbag for my wife out of it.
She did not want that. That is so weird.
Yeah, I know. I don't know why, but there you go. So
I actually get discarded. So, like, we haven't quite got to this. I mean, look, there was a period where a couple of the centers were collecting them for some research purpose, like at some point in time. Not at the moment that I'm aware of, but I mean, there's still a lot of research going into understanding about how fat cells differentiate, for example, and all that. So there are a couple of centers in the past that would have collected them for research, but at the moment, like, we always weigh the skin. So sometimes it's like, I do make some jokes with my patients, say, guess how much skin I'll take off this time, and we'll see how close it matches the expectations. But we always there's some documentation, but apart from that, we get discarded just like any I guess human waste sort of processing, I suppose.
I know that it's definitely been asked a number of times in our support group if the skin can be donated, to help in any other medical conditions, and I thought that there would that would probably not be the case yet, that we wouldn't be medically advanced enough yet to do that.
No, we
So
haven't got the tissue banking. Like, I mean, like people might have heard about, the use of cadaver skin for, like, say, burn surgery, but, it is harvested in a quite a different way. So, we haven't quite,
again,
like, I think it's the resource limited kind of steps as well. We just haven't quite got that ability to do so. But you never know. It might be contributed to some research, if the right time comes. You never know.
that's right.
And no handbags at the moment.
No handbags either.
Oh, well. She'll have to wait. Now, a couple of questions that we ask everyone that comes on our podcast. First one, if you could choose a superpower besides being an amazing plastic surgeon, what would it be?
Oh, that's a really hard question. I haven't thought about that. But well, I think if I can do something, I will somehow want all my surgery to be scarless, and I think I'll have much happier patients. That could be my superpower.
Yeah.
I love that.
Yep.
I love it.
Oh, we might be close to that one day, but at the moment, if I can wave a wand and all this scar goes away, that will be my happiest moment. I think.
Yeah. Still so patient centered.
Yep.
I love it.
Absolutely.
Your favorite thing to do in your downtime?
I would be maybe sleeping. No, actually, I think I really enjoy. If I have the opportunity to really just go travel the world and really see the rest of the world, I think that would be quite amazing. I think there's still a long list of bucket lists that I want to keep ticking off, as I go, especially in some of the more remote areas. So if I had downtime, like a significant downtime, I love to keep traveling and just keep seeing other cultures and experience the world.
Yep, I love that too.
Amazing. And last one. What is your favorite meal?
Sorry, missed that one.
Your favorite dish, your
favorite
food to eat.
Oh, my favorite food. Wow. Okay, that's also a very hard question because I'm not very picky with my food actually. But maybe like a good I don't know, maybe a good sort of sushi dish or something. Like, that's a light enough, not too heavy. I feel like that's a good sort of process. So, I'm heading to Japan in a few weeks. So that's definitely on my top list, having some good sushi.
Me too. I love that.
My wife and I, it's my birthday today, and we're going into Melbourne tomorrow for a couple of days, and we're going to hit up a nice Japanese restaurant somewhere. So that's going to be fun.
Oh yeah, I mean a good sushi is always nice. Healthy enough that I don't feel too guilty if I had a bit more. I think.
Yeah, that's great. Thank you so much for joining us. It's been such a pleasure to chat.
Yep, thank you.
Yeah,